Hello, I'm Dr. Vince Pankonin from Dr. Big Brain Neurofeedback Clinic in Perham, Minnesota. Today we're going to talk about neurofeedback and a variety of different conditions that we treat with neurofeedback therapy. The goal of all neurofeedback therapy is to identify abnormal brainwave patterns that cause problems in our life and train your brain or rewire your brain on how to create a new pattern that is much more efficient and void of the symptoms that we are experiencing today. So the first condition I want to talk about is depression. So neurofeedback, helping people with clinical depression or just long-term depression from what you've experienced in life. Many people with depression have abnormal brainwave patterns because of chronic stress that has been in their life for many years sometimes. And we all experience that, and it's normal to feel depressed once in a while, but when it starts to last for weeks and months and really starts to impact how you do your life. Maybe you are becoming avoidant, you just don't go out with your friends, or you don't go to social engagements, or it's even a struggle just to get to work today. This is when depression becomes more than just a passing thing. So with neurofeedback therapy, we have people do what's called a QEEG, which is a way to record the electrical activity of their brain. And we look at the patterns of the different brain waves, which is how our brain communicates with itself. So in particular, we are looking at alpha brainwave patterns and beta brainwave patterns. When those are dysregulated from normal, and usually that means they're active on the wrong side of the brain. So alpha is typically a right-sided brainwave pattern. Beta is a left-sided brainwave pattern. Chronic stress and traumatic events of our past sometimes cause those patterns to shift and now become more prominent to the opposite side of the brain. This creates this dysregulated pattern. It's inefficient, and it starts to change our mood and our thought pattern, and it makes it harder to just control our emotions. And this is where depression leads from. So with neurofeedback therapy, we can tell your brain or guide it to become more efficient, to make new connections called reorganization of the brain, to make that impulse more efficient and that pattern more efficient, and the symptoms that go with that, like depression and down moods and maybe anger that is not normal for you, that starts to fade away as the brain learns to regulate that pattern better. And that is how neurofeedback works. If you have any symptoms like this, or have friends or relatives that are suffering from this, have them check with us at Dr. Big Brain Neurofeedback Clinic. Check out our website. There's great information there. You can call our office at 218-210-2412. Get some information, set up a free consultation. We can talk about it, see if neurofeedback therapy could be right for you and get you on to a better lifestyle.